Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on COVID-19 for the Appalachian Highlands for the week of July 12th, 2020. As you know, I like to follow deaths per million, so if you go to Worldometer and hit the US and then hit deaths per million, this is where we were when we started looking at this several months ago. At the time, Virginia and Tennessee were vanishingly small compared to New York. Every week since then, the numbers have grown consistently, such that now we've seen a five-fold increase in Tennessee and an almost eightfold increase in Virginia. And New York, which was hit the hardest early on, has not seen nearly that level of increase. I've shown you this before. These are cumulative deaths across the U.S. where we saw a dropping rate and then it's been picking up again. We've seen the same pattern in Virginia until recently, when there's been a pretty significant uptick in the number of deaths per million in Virginia, quite a ways ahead of the U.S. So if you look at this cases in Virginia, again, it went up for quite a period of time, then came back down, was level for a while, and now appears to be picking up again. Tennessee has not seen that level of maturity. Our growth rate has continued to be quite robust, unfortunately, quite rapid. And if you look at the number of cases and deaths, you can see that it's been level for a while, but has been shooting up. So I think Tennessee is earlier in its pandemic than Virginia, which is probably a little bit earlier than the rest of the U.S. This is data from Dr. Abby Mann in the Quillen College of Medicine, and she has analyzed cases and hospitalizations here in Northeast Tennessee. The blue line are new cases, and you can see they've been going up. Now, sometimes people say, well, cases is just a matter of testing people. That's true, but if you test people, they don't end up in the hospital. So hospitalizations and deaths are pretty good measures, and what you can see is a pretty consistent growth rate. So we're probably lagging a little bit behind the rest of Tennessee, which is lagging behind the U.S. So unfortunately, it's probable that we're going to see the worst is yet to come. Tennessee's reported 60,000 cases, 738 deaths. Virginia, 70,000 cases, almost 2,000 deaths. And our region, 10,000 cases and 185 deaths. That's Southwest Virginia, Northeast Tennessee, and Western North Carolina. There's still a lot we don't know about this pandemic, but all of the data suggests that it's still evolving and still growing, especially in our region, especially in our state. There's a great deal more information about COVID-19 on the College of Public Health website. If you go to this icon, you can look up a variety of different things. But if you have any specific questions, please let me know. I'd be more than happy to try to find an answer for you. Thank you very much.